day. My name is Karambilans Constantinos. I'm a student of University of Education, Winneba, Graphic Design Department. The quest today is to educate the general public, especially the youth, on sexually transmitted infections. Sexually transmitted infections are illnesses that can be transmitted from one body to the other through the coming together of body fluids. In this short documentary, we take you through an in-depth knowledge of sexually transmitted infections. What are STIs? STIs are also called venereal diseases. They are caused by germs that live on the skin or in the body fluids such as semen, vaginal fluid or blood. The germs are passed from an infected person, often through sexual contact with skin, blood or body fluids. These germs can enter the body through the vagina, mouth, anus and open sores or cuts. Types of STIs. There are so many STIs. These are but a few: HIV/AIDS, gonorrhea, syphilis, chlamydia, hepatitis. Let's take a quick look at the commonly known STIs. HIV/AIDS. HIV weakens your immune system, your body's built-in defense against disease and illness. You can have HIV without knowing it. You may not look or feel sick for years, but you can still pass the virus on to other people. Without HIV treatment, your immune system can become too weak to fight off serious illnesses. HIV can also damage other parts of your body. Eventually, you can become sick with life-threatening infections. This is the most serious stage of HIV infection, called AIDS. Gonorrhea. Gonorrhea is caused by bacteria which are found mainly in the semen and vaginal fluids of men and women who have the infection. Gonorrhea is easily passed from one person to another through sexual contact. Anyone who is sexually active can get it and pass it on. You don't need to have lots of sexual partners. Gonorrhea is usually passed from one person to the other during sex. The bacteria can live inside the cells of the cervix, entrance to the uterus, the urethra, tube where the urine comes out, the rectum, the throat, and occasionally the eyes. You can become infected with gonorrhea if you come in contact with infected semen or infected discharge from the vagina, throat, or rectum. Syphilis. Syphilis is caused by a bacteria known as Treponema pallidum. This is easily passed from one person to the other through sexual contact. Anyone who is sexually active can get it. Both men and women can have syphilis and pass it on. You can pass syphilis on without knowing you have the infection because symptoms can be mild and you may not notice or recognize them. Syphilis can be passed from one person to the other during sex and by direct skin contact with someone who has syphilis sores or a syphilis rash. It can be passed on before symptoms are noticeable or after they've disappeared. Chlamydia. Chlamydia trachomatis is a sexually transmitted bacterial infection. In males, it affects the urethra, tube inside the penis, and in women, it affects the urethra and cervix, neck of the womb. It can also infect the rectum and sometimes the eyes and throat. Chlamydia is transmitted through contact with genital fluids from the penis and vagina. If you have vaginal sex or anal sex without a condom, you may become infected. Sometimes oral sex can transmit the bacteria. Other sexual practices such as mutual masturbation or fingering may result in the spread of infection. Chlamydia can be passed from mother to baby during birth. The baby may develop an eye or lung infection as a result. Signs of STIs. We go on to look at some signs of STIs. Signs may occur for days, weeks, or months after exposure. Some men and women have no signs but have STI and can pass it on to others. Common signs include burning during urination, genital ulcers such as open sores or blisters, warts, skin rash, discharge from the penis or vagina, abdominal pain, most often in women. Preventions of STIs. Let's take a look at how to prevent STIs. Abstinence or no sexual relations is the best way to prevent the spread of STIs. If you choose to have sexual relations, have one partner and always use latest condoms that have nonoxynol 9 and used with spermicidal jelly. Most STIs are treatable. Some can be cured, but others cannot. Medicines can be used to help signs and also prevent the disease from getting worse. Testing for STIs. STIs are testable. You should be tested for STIs if you 1. Have had oral, anal, or vaginal sex and did not use latest condoms. 2. Share needles to inject drugs or have sex with someone who does share needles. 3. Feel you may have been exposed to or have signs of an STIs. You can be tested for STIs by a doctor or at your local health department. As part of your care, avoid sexual relations until you and your partner have been treated. Take antibiotics as directed until your treatment is done. Be sure to take all of the medicine your doctor orders. Call to make an appointment to repeat sex 3 weeks after finishing your antibiotics. Return to the emergency department or call your doctor if your signs get worse or you have a fever of more than 100.5 degrees Fahrenheit or 38 degrees Celsius. There are risks of other problems and more serious diseases if you do not get treatment or get incomplete treatment. Talk to your doctor or nurse if you have any questions or concerns. Always remember, good life, it's an everyday thing. Good life, live it well, play safe. Thank you.